So welcome, everyone. Here we are at office hours. We're happy to have with us today Jaideep Tandon, Chairman and CEO of Infinx. Welcome.
Thank you.
This week, we're going to talk about a very important topic. We're going to talk about whether or not your AR strategy will deliver a robust 2023. And certainly that is something that is desperately needed after the past 3 years or so that hospitals have been through. As we go along, please feel free to type your questions in the chat section, and we'll get to you at the end. So the years since COVID hit in 2019 have just been a financial tsunami, I think, for healthcare institutions. They haven't been able to pick themselves up between financial blows. So that's what we want to talk with you about today. And I think probably we should start discussing the majority of hospitals, they've suffered billion-dollar losses, even the major ones, Cleveland Clinic, Mass General Hospital. So they're still reeling from that. They're still trying to figure out how to rebuild in the COVID world, because I think this is it, where there's no going back. So although there are many factors, what would you say is the most important thing that they should consider when outlining their 2023 AR strategies?
Yeah. So, Deborah, I think what I'd say is as you mentioned, the last 2.5 years have been tumultuous in healthcare, to say the least. Hospitals have seen some massive swings on how they operate and dispense care and service their local communities. The staff at every level within these enterprises, right, stretched to the limits, high stress levels. And with the government intervention during the pandemics, the hospitals were able to react to the health crisis the country faced and really sort of helped their communities. But as things ease back to normal, we've started to see the aftermath in terms of the financial health many of these hospitals face. They're dealing with staffing shortage, low employee morale, high labor costs, other inflationary pressures across the board, and not to mention the sort of constant changing landscape of healthcare policy and reimbursements that they have to keep adjusting to. So set against this backdrop as we go into 2023, sort of having a focus on the financial health is critically important for these hospitals to really be able to continue to deliver financial results so that they can service their communities. And one key area to start off with is the overall revenue cycle operations, and more specifically, how the AR looks. What we see as AR is an area where you may think you're making money, but you may have it all tied up. You need to unlock that cash. So when it comes to deploying a strategy to manage AR and minimize the revenue leakage, the very first step is to get an assessment, baseline where you are and what's working, what's not working. You can't make actionable and meaningful decisions if you're not working with accurate metrics and data. So as an example, you can't effectively chase AR down if you haven't been routinely liquidating your charges, writing off bad debt, or accounting for contractual adjustments. Having strong workflows and processes to manage revenue cycle directly leads to how you address that AR. So once you have the visibility, you have to take a holistic view of the addressable AR and deploy the appropriate technology and resources to convert it to cash. You can consider deploying workflow and automation tools to address the high volume of claim follow-up. Also consider outsourcing aspects of the aged inventory. So there are sort of many approaches you can take, but there's no sort of one size fits all, depending on the size of the organization, the type of AR, the payer mix that you see. You have to sort of right size the solution approach you take. And there's enough expertise out there today that the right solution can be designed and implemented to match the unique situation your enterprise may be in.
So you mentioned bad debt. Before we go on, let's talk about that a little bit, because there are a lot of hospitals that saw an exponential increase in their bad debt, and for many different reasons. Some of the hospitals, it was charity care, right? Uninsured. The number of people who are uninsured that started coming to the hospital increased a lot for some hospitals that have a large population of the underserved in their territory. So how do they start to get their hands around bad debt? What are some of the tools that they can use?
Yeah, so I think the key there is, again, coming back to understanding what's contributing to that bad debt. Very often, obviously, there is bad debt from a patient's inability to pay, from an uninsured patient's inability to pay. Obviously, during the pandemic, the government had enough incentives for hospitals to continue to dispense care and support these types of programs so that the hospitals did not face financial setbacks due to providing that care. However, as you come out of it, you have to really look at the fact that the bad debt coming, there is a lot of bad debt stuck in your AR due to just not running your revenue cycle operations efficiently. And those are the ones that's easy in terms of addressing first to write off, clean up your AR so that you can focus on where the cash lies and go and chase that.
So you mentioned we start with the assessment, get some good data, understand what's buried in the AR, what could be addressed. What would you say is there any such thing as a second step? I mean, that's a pretty massive first step.
Yes, I think it is a massive first step, is to see the reality you're dealing with, right? And then from then forward, I think you're able to really sort of parse out where the opportunities for cash lie. And you'd be surprised there are sort of some really easy things you can do to get cash generation going. There's sort of old AR that you can look at, say 90 days or 120 plus days, and put together a project team and a solution to basically address that and start to monitor that. I mean, the one thing we recommend is whatever project you do, define the boundaries and have a methodology to measure the performance, because that's really what tells you if it's working or not. So continuous measurement and improvement yields to an ongoing improvement in cash collections. And along the way, what we see as we deploy these programs is you start to see issues and inefficiencies that may exist in other aspects of the revenue cycle operations that you can go in and optimize. And that's usually a sort of a one-step fix that really helps your AR, and you have declining AR on a go-forward basis. So you're sending clean claims out and you're getting paid for them.
So given the staffing shortages that everyone's dealing with, then it doesn't look like that's going to turn around anytime soon. What kind of tools and technology should hospitals be looking at to help them do all of these important tasks, given the fact that the patient access and the AR people probably aren't coming back? And in fact, I know of one hospital that their finance department is down to one person.
Wow. Yeah, no, I think we hear that very often, the employee turnover, not just in the clinical side of the hospitals, but across the board in the operations and administrative side, that there is a lot of churn, right? And managing hospital revenue cycle is a balancing act. I mean, on average, you're dealing with over 1,000 insurers with a multitude of plans and reimbursement rates that change every year and have patient populations spread between private insurers, Medicare, Medicaid. So as we go into the new year, I mean, I think finance executives across all of these organizations are really tasked with a tall order of trying to generate cash from operations and care dispensed in this year, in 2022, and how can you really unlock and bring in cash for that? So I would suggest sort of post-assessment, really identifying 2 or 3 key priority areas with an RCM focus that they want to try and go solve. But it's a beast. I mean, RCM in hospitals can get to be a beast, so you don't want to try and do too much, rather get some small wins and build on that success. So cleaning up old AR is a very natural first step. Often staffing levels prevent in-house teams to focus on some of the older AR. So In many of our engagements, we see that there is a tremendous value in that old AR and can meaningfully impact the bottom line of a hospital. Just recently, we deployed our AR recovery solution for an acute care facility, just taking over their 120 plus days AR, not disturbing their overall RCM operations. And after an initial assessment, we were confident we would be able to recover a substantial amount of cash for this facility. Sort of 60 days into the engagement, we started seeing the results. We were collecting on average $500,000 per month. And as we close out this year, we would have collected a little over 6 million additional cash that they would not have seen otherwise. And this is all dating back to care they dispensed in 2021 and earlier this year. But along the way, we were able to provide recommendations to them that has overall improved their RCM operations as well, so that less of it ends up in that 120-day bucket as well.
Incredible. So what about the chicken and the egg? You know, there's technology can help, and then a lot of people will say, well, I can't afford the technology, and I'm cutting, and I know you're telling me that it's going to bring money in the door, but I can't afford to put the money out the door to get it in. What do you say to those organizations?
Yeah, I think technology can and does come to the rescue, but it comes with a price tag. I see many organizations intimidated by deploying new technology to assist revenue cycle operations. But for that same reason, they're like, will it get me the results I need to demonstrate? And very often, these technology deployments get caught up in competing priorities with CIOs and other leaders within the hospital. So what we suggest is sort of a crawl, walk, run approach. There are many solutions out there. Everything we do today is variably priced to address, tied to the results we bring for our customers. So there are, and we're not the only ones. Most of the solutions designed out there today can address aspects of revenue cycle and provide immediate relief. These solutions don't require long, expensive implementation or training cycles. And can be used sort of as a long-term solution or a stopgap to really show results. Most of these are SaaS-oriented solutions, so very small footprint with regards to IT, in-house IT, requires very little involvement from them. And you can start seeing results very, very quickly. You get there's analytics that tell you, where you're how you're performing, and then the actions that you're taking, what impact they're having on your performance. For instance, often we see denials related to either incorrect insurance information or lack of prior authorization. And these shouldn't be denials. Instead of chasing these denials as in the back end as part of AR, there's technology approaches that can be implemented that are pretty light to address a majority of these things in the front end and prevent the denial in the first place itself. So when we look at AR, it's just not an AR problem. It's a broader thing of what is causing that AR, and can we fix the root cause while trying to unlock cash from the AR on hand.
Unlock cash would be the key part of that statement, I think. For most organizations, that's kind of job number one, right?
Yep.
So to wrap up, could you identify for us, based on what you see from your clients across the country, what you think the top 3 AR challenges are that can be addressed in 2023 to give people some hope?
Well, we should all go in with a lot of hope into the new year. So these AR challenges will exist, probably manifest themselves a little differently, but it's about making step-by-step improvements to your processes to really show results. So what I recommend really is get an assessment done to baseline your revenue cycle performance and understand where there may be opportunities for improvement and real cash opportunities that can be realized in this short term. Because if you try to do too much, you're just going to get lost in the weeds and you won't have results to speak for. identify key projects at the beginning of the year and set up a framework to monitor and measure the performance of these projects. So if you're tackling old AR, or if you're wanting to tackle certain credentialing issues you may have, or something along in the patient access realm of prior authorization, or insurance verification, don't get caught up in long technology deployment cycles or RFPs and over analysis. Try out a few things, be agile, see the effectiveness of this, and then move on from there. And that'll, once you start to see the results, you'll be able to build on that success and demonstrate the next step forward. And don't be afraid to ask for help. Technology and subject matter expertise is available across the board. I mean, healthcare is, I think, 23% of the GDP of this country. So there's a lot of smart minds looking at this industry and seeing what aspects of it can be made more efficient. So there are ways to adopt new approaches and new technology to solve some of these issues.
Excellent wisdom. Thank you. And I think don't overanalyze is a new watchword for that healthcare executives should take into 2023. So thank you very much. Is there anything else that we didn't talk about regarding AR and hopefully having a robust 2023?
No, I think we covered some good points there. I think there's going to be certain aspects of challenges, of course, as they present themselves going into new year. But I'm super hopeful and excited as we go into 2023 for us as a business and our ability to help customers in the RCM space and helping them address some of the challenges they face. And I think the combination of the subject matter expertise and the technology, there is a lot to be that can be covered in the next 12 months.
Yeah, absolutely. Thank you. And this has obviously been an overview, a broad cross section of looking at AR, and in coming webinars, we can do a deep dive into some of the very, very specific details. So thank you so much. We've been talking with Jaideep Tandon. He's the CEO of Infinx, and we've been talking about how to make your AR strategy deliver a robust 2023. So if you have any questions, please send them our way, and we'll look forward to seeing you on our next webinar. Thank you for your time.
Thank you, and Happy New Year to everybody.
Thank you. Happy New Year.